So I wouldn't be discouraged if you haven't got any educational background, you didn't finish school. There's always a pathway. It's just how you get to that end goal. So, of course, if you finish school, that pathway is more traditional and you can go straight into, a certificate 2, 3 or 4. If you have got a bachelor's degree, you'd most likely go straight into that as well. But if you've got no formal study, it's not to be discouraged. It just means you might start at a lower certificate level and then work your way up. And that's really all just about building the knowledge.
Welcome to the Pet Care Report podcast by Pet Summits. Here's your natural dog healthcare host, Alora McKinley.
G'day guys, welcome back. Now I'm going to jump straight into today's episode because whether you're considering a career change or maybe you're in school and not sure what to do, why not consider becoming a vet nurse? To chat about everything you may need to know before becoming a vet nurse is Dr. Roz, a holistic vet nurse with expertise in animal rehabilitation, naturopathy and homeopathy, and is dedicated to teaching pet owners about natural and non-invasive care methods. Before her nursing career, she was a senior university researcher in human behaviour and interaction. Her research experience now guides her in finding innovative ways to benefit both pets and their owners. Thank you so much for joining me, Dr. Roz. It's lovely to have you on.
Thanks for having me. I'm very excited to talk all things holistic vet nursing and vet nursing today.
Very exciting. Now, I know vet nursing is a little bit more than just cuddling cute puppies and kittens. It takes quite a lot of training. What kind of skills and qualifications are needed to become a successful vet nurse?
Yeah, so obviously it varies from country to country, but in Australia, there's a few different pathways that you can now take. So if you've had experience in working with animals before, sometimes you can jump straight to a certificate 4 in vet nursing. You might have to, if you haven't had experience in working with animals before, start out in a certificate 2 or a certificate 3 in animal studies. But now in Australia, some universities are offering 2 different types of degrees. So that might be a bachelor's degree in veterinary nursing, or we are adopting more of the American model and offering bachelor's degrees in becoming a vet tech. Similar roles and similar job prospects at the moment in Australia for that.
Interesting. So what kind of educational background or certificates are typically required? Do you need a Year 12 pass?
It depends on the college or how you sort of want to go about it. So I wouldn't be discouraged if you haven't got any educational background, you didn't finish school. There's always a pathway. It's just how you get to that end goal. So, of course, if you finish school, that pathway is more traditional and you can go straight into, a certificate 2, 3 or 4. If you have got a bachelor's degree, you'd most likely go straight into that as well. But if you've got no formal study, it's not to be discouraged. It just means you might start at a lower certificate level and then work your way up. And that's really all just about building the knowledge. So when you get to that certificate 4 or an advanced diploma, you've got all the knowledge that will make you really successful in completing it. So there isn't really you can't do it. It's just, it might be a different way to get there for you.
I see. And are there quite a lot of jobs for vet nurses?
In Australia, yeah, we're experiencing a shortage of vets and vet nurses. So if it's something that you're interested in, the job prospects are there. Obviously, it's not a lucrative industry. It's well known that nurses don't particularly get paid the highest salaries. We tend to do things for the love of it. But that's where, adding to your skill set can make you more employable, can give you options, for a side hustle and things like that to, boost that income that might not be exactly what you want.
Yeah. And now I know that nurses have such a huge role they have to play. What does the typical day look like for a vet nurse?
So if you're a vet nurse working in a clinic, traditionally speaking, you might be on one of 3 shifts, and that depends on if you're a 24/7 clinic or a 9 to 5 clinic, but there's a morning shift, usually a midday shift, and like an evening or a night shift. Morning shift tends to be you're doing nurse consultations. So that's when you're working alongside the vet before the vet comes into the consult room, and you're taking the animal's history. You're doing all the important nurse checks like their vitals, their dental. You're talking to them about nutrition. You might be admitting patients ready for surgery. Then during the middle of the day, most clinics shut in terms of they don't see consultations. We switch into surgery mode, and that's where a nurse might be a surgical nurse, and their role is to get the patients ready for sedation, get them ready for anesthesia. They might induce a patient, and then they're responsible for keeping them anesthetized during a surgery. And some surgeries might be 10 minutes, some surgeries might be 4 hours or longer, depending on what kind of surgery that is. And those surgeries can be anything from, a spay or a castrate to a wound repair to an exploratory laparotomy, or, orthopedic surgeries are really common in clinics now as well. So there's lots of different surgical procedures. And then in the afternoon, that tends to switch back into preparing patients to be discharged, or if they're going to be in the hospital for a while, you'll be handing back over to that clinical nurse to monitor and recover those patients, or to stay overnight with them. So where I have practice, we don't have 24/7 clinics. So you're either working late and then just making sure that the animal can cope on its own overnight. But a lot more clinics interstate are 24/7 clinics. So you're a shift worker.
Wow, it just blows my mind how many roles vet nurses have to do. You really have to be trained in so much. Not only that, I'm sure there's also like a lot of admin stuff that they have to do when dealing with pet owners.
Yeah, so obviously anything in the health industry, there's a lot of paperwork. So paperwork is important in terms of that's how, if you have pet insurance, that those pet insurance claims get paid. It's also how we keep track of your animal's health, how they're progressing or they're deteriorating, or, if we need to inform other people involved in their health, how that, is transferred across. So yeah, there's lots of paperwork, but it's like any job. We always sort of diminish the paperwork because nobody loves it.
No, it drives me crazy. So what are some rewards then that come from working as a vet nurse?
For me, like particularly because I'm sort of can split between clinic and my own mobile practice, is that recovery. When you see a dog that's really, really unwell, and then, over time you work with them and then they're back to their normal selves, and just seeing how happy that makes the owner, that's of course really rewarding. But also when you see owners who get a puppy and then you get to see that puppy or kitten or whatever their animal is literally through their whole life, you grow up with that person and the animal, and they become a really key part of your life too. You not just know the story of that animal, but you know how that animal fits into that person's life and that family, and then that family might expand, whether it's more animals or kids and things like that. So you become quite, intimate about the day-to-day lives of a lot of people and a lot of dogs. And I always say I'm terrible with people names, but I'll see a person and then ask them how's their dog, not necessarily how they are, because we just get so used to, treating all their animals. And that's just, that's a very typical vet and vet nurse thing, is we're always asking how the animal is before the person. Don't take it personally.
And then in terms of challenges, I know there's a huge crisis that you mentioned a little bit before facing our veterinary industry. Here in Australia, we've got a huge shortage of vets. And not only that, the job carries like a huge mental burden at times. And I read one statistic that said that vets are almost 4 times as likely to take their own life when compared to the general Australian population, which is just a phenomenal statistic. And now, of course, our vet nurses are on the front line and they cop a lot of this stress as well. So I guess what kind of hardships does being a vet nurse carry as well?
Yeah, there's definitely a lot of hardships. I mean, nobody likes saying goodbye. The euthanasias are very stressful because you're there. Like I said, you've just seen this animal probably through its whole life, and then it's time to say goodbye. And that can be often in tragic circumstances, but also it can be because of old age. So euthanasias at end of life is always really distressing. Most people who work in the health industry, whether it's, human or animal, they tend to be empaths. So it does impact them deeply. And then, we also deal with welfare cases. So, even doing holistic stuff and going to people's houses, there are still times where I walk into those environments, and that's a welfare case that needs to be either reported to welfare or the RSPCA, depending on what jurisdiction we're in, or the police. And we're just we're often just the messenger. We don't often get to see the outcomes of those cases, but we see that, and that's very confronting, some of the things that we see, especially if you love animals and then you see, animals maybe not being treated how you would like to see that, and then not having control over that. Yeah, that's very confronting. And the biggest thing that was told to me when I started the industry was you have to have someone that you can talk about these things with. And sometimes that can't be your family because it's confronting things, or it could be confidential things that you can't discuss. So having a confidant in the industry, whether it's someone in your practice or someone outside of your practice, or, a fellow nurse or a fellow vet, some sort of confidant that you can discuss these things with, so you're not bottling them up. But also, don't be afraid to have a good cry. Some days I just get in my car and you just have a really good cry. Or, you just play Shania Twain really loud and get it all out. But you have to have those outlets, right? Because you're dealing with it all the time, and we love animals, but, it's just like we love any job we do, but there are days where it's not so lovable. So, you got to get back up and have ways to get back up. And yeah, it is hard for vet nurses and vets. So yeah, find someone. Even if it's just one person, you have to have someone.
I love that. That's such a great tip. It's so important to debrief sometimes, especially when we have a really stressful situation happen. Really good to talk it out. And how about pet parents? How do you find dealing with some difficult pet parents?
Look, I think a lot of the time it's pet parents are just passionate. Yeah. And sometimes the line between, passion gets blurred, right? We talk about in animal behavior, we can go one of two ways, and that's lust and rage. It's not really any different when we have passionate pet parents. But a lot of that comes down to is they just want time. They just need the time to process the information, understand how that impacts both them and their pets, and, what's the way forward. And I completely understand that in traditional clinic models, that's crammed into a very short period of time. So, that's the beauty of what I get to do being mobile. If it takes me an hour or it takes me 2 hours, I'm at that house explaining those things or going through options or administering that care. So that's something I think pet owners or even nurses should be aware of, is don't forget that time is important, and don't rush somebody, because it's their pet and they deserve to understand exactly what we're doing to them, why we're doing it to them, and then the impact it's going to have on them, because we hand them back to the owner and then they have them, and it's their responsibility to look after them. So, definitely don't, just rush that. I'm that nagging nurse in the clinic that probably does slow things down, but I think we see a lot more worth, and I think we get repeat business if we take the time with pet owners to spend time explaining and educating them.
Yep. And I love that you touched on the differences just being a mobile vet. So what are some of the differences that you've noticed being a mobile and holistic vet nurse from just working in a clinic?
Yeah. So for me, I get to really just focus on the niche things that I love, which is really, herbal medicine, homeopathy, rehab. And I can schedule my day. So I can take, as long as I want to see a patient. I don't have to rush. But for me, I'm really dealing with a lot of referrals. So a lot of the things I see in my mobile vet nursing business usually come from vets that refer to me. So that might be a traditional vet who doesn't practice in integrative or holistic medicine, but they don't feel like they can manage the case, or they want to give the pet owners some different options. So they might refer to me, which is really cool because I get to see cool cases and work that with a traditional vet. But sometimes I get referred cases too from holistic vets that just have really full workloads and want to share that, or, want to brainstorm stuff together, which is really cool because it's also like a message. Sometimes I think vet nurses feel like they sit under vets and they're not valued, but, we do have a lot of knowledge and a lot of skills and a lot of things that we can bring. particularly if we have additional skill sets, in different modalities and things like that. So that's why I always encourage nurses, if they're feeling a little burnt out in the industry, what is it that you're passionate about? Go and upskill in that and see if your clinic will offer that, and most of the time they probably will, because it's going to bring in new clients to them anyway. And if they won't, you can go and offer that on the side. So yeah, that's the cool thing about, having a bit of ownership in your day is, you can make it what you want.
Yes, and I love that that's what you've done, because you've gone to explore holistic alternatives such as herbal medicine and rehabilitation. What led you to do that?
So I kind of came to the industry in a roundabout way, although it's probably a common way that most people come to the industry is, I say it all started with a dog. So, in my adult years, I had dogs as kids, but, that I didn't take full ownership of them. But I got a dog. And I was like, we had dogs as kids. I've got this. And then I realized I actually didn't have it. He was an absolute nightmare. And all the things that were being told to me were like, he's got to be on medication. He's just a nutcase. You've got to feed him all this highly processed food. And I'm just in my head going, I'm a senior researcher. I work on all these, medical and health projects. There's nothing sound. There's no sound evidence to support why I should be doing this. I need to go and do a bit more digging. So I just went down, obviously, my own little research path. And I remember saying to my husband, I think I'm just going to become a vet nurse, and I think I'm just going to become a naturopath. And he just was like, here we go. Because he knows that that's just me. Like if I want information, I'll go and find it, or, I'll find it to a point where then I just may as well get the skill set in it because I've just got so entrenched in it. But yes, my dog Sid, he didn't have all these problems. He just needed good food, and, some natural health care and, some basic behavioral modification. But he was certainly not, the extreme dog I was led to believe. So I went in a roundabout way and then went, well, you know what? I'm a bit tired of working in academia. I might just, sit on the periphery of that and have it there and pursue this. And yeah, I haven't really looked back since.
Wow. And so I'm sure then your day looks so different depending on what type of patient you're seeing. What kind of things do you do during the day?
So it can vary. So it can be a day where it's just normal nursing things. Like I might go and be asked to collect bloods or give some injections for a vet, or, do anal glands. No one wants to do that. Or nail clipping. Or I might then have a day where I'm going to, do palliative care, and the dog's at home, it's on fluid therapy and it's just there until the owners are ready to say goodbye. I might go and see a dog or a cat or a horse, you never know, and be looking at some herbal ways we can support the diagnosis that they've been given, whether it's skin, it might be gut health. I do a lot of nutrition consults, and then also I do rehab. So I get a lot of referrals from vets to do physical therapy. So whether that's massage or hydrotherapy or cold laser, and we just tailor that depending on what kind of case it is. It might be, we get lots of like dachshunds who are paralyzed. So from intervertebral disc disease, lots of cruciates. I think, we're seeing just a huge rise in cruciates and luxating patellas. So they become surgical cases, and then they become rehab cases. And in some instances now, looking after pets has become expensive. So physical therapy and rehab has become a more conservative way to manage these conditions outside of surgery. So giving more options to pet owners who really want to look after their pet, but completely understand, that $5,000, $10,000, $15,000 for a surgery, we're looking at remortgaging your house. So providing that has become a lot more popular over the last few years, and still really with successful outcomes, but it just gives this whole new avenue to caring for dogs and cats.
Yeah. And then in your clinic, because I know you're based up in Darwin, do you travel far?
Yeah. So sometimes I travel up to 300 kilometers to see. So I sort of service not just like the Darwin greater area, but sometimes I'll go further down, into sort of Katherine, Central Australia. But we also, like, we've just set up a clinic space so we can have people come to me as well. And also we have placed an integrative vet there as well and a dog behaviorist. So we've kind of created a hub now. But yeah, I do travel a lot. That odometer in my car just seems to be, hitting the hundreds of thousand kilometers a year. But I like being able to get on the road, because seeing where animals are in the environment they live in tells us a lot about how we can support them as well. And it also reduces the stress, particularly for cats. When someone rings me and says, can you come and see my cat? You hear the sigh of relief on the phone, because they know that their cat's not going to have a meltdown at home. And I'm glad too, because I know in clinics, we would always have the bet on who would get scratched first from the stressed cat. So we can minimize that stress by visiting their home. I'm all for that.
That is so cool. Now, what led you to start your own raw food range?
Yeah, so we started Australian Pet Nutrition, which is like the raw food and the supplements, knowing that we were entering a market, especially in Australia, that was flooded. It's everywhere. And, you only have to like one dog picture on Instagram and then there's 40 ads for different supplement companies coming up. But we really wanted to disrupt that. And, I don't discredit any supplement company out there, but we really wanted to try and have supplements only if needed, but guide them through food first, and be really honest and transparent and educate around, only supplementing if it's absolutely needed. It seems to me, as we were, entering into the market, that there is just this trend now that if your dog's or cat's bowl isn't literally just like full of all these powders, you're not a holistic pet parent, which just blows my mind, because, my challenge on the flip of that is, can you try and have nothing in your pet's bowl except fresh food and utilize food first? And then if absolutely necessary, or you're treating a specific condition, then great. Okay, well, let's add something in that's really high quality and really necessary. But yeah, so people find it funny when they ask me, like, what supplement of your range should we buy? And I say nothing unless, you're focusing on food first. So a big thing for me is like, yeah, we offer these supplements, but it's really about trying to disrupt what's going on in the industry and pushing for a lot more honesty and education, and not just pushing a lot of people into supplements for the sake of it, and then guilting them that they haven't got 20, in their pet's regime. And I get lists when I go to people's houses. They bring out like a trolley full of all these supplements, and I go, they're great. Like, they are all amazing supplements, but are they really needed? Most likely not. So, simplifying things and educating is really why we did it.
And it's expensive too. Goodness, if I was to feed 3 dogs a whole list of supplements, I couldn't imagine what my bank account would say about that.
I know.
Now, long-term careers in vet nursing, what kind of opportunities exist?
So it depends if you want to go down the holistic path or you want to go down the traditional nursing path. So I'll talk to both. In terms of traditional nursing, you can upgrade to like an advanced diploma. That's really more if you want to go down the administrative line, in my opinion. So if you want to be a practice manager. If you want to stay sort of in the clinical side of things, you of course should be a registered vet nurse, and then you can upskill to an accredited vet nurse. And being registered and accredited is really important because you're responsible each year for fulfilling professional development. And that's really important. You want to stay current. And then if you're really passionate about particular areas of veterinary nursing or vet medicine, we have in Australia now sort of adopted, or we work alongside what's called the VTS, so the veterinary technician specialist or specialization sort of model, where you can pick, say, rehab or internal medicine or dentistry, or there's 16 different specialties. So don't ask me to, rattle them all off. And you can go and study and upskill and then sit exams to become a VTS specialist in that area. And I'd really like to see that progress, obviously, in Australia, to be a way to manage the shortage of staff that's happening across the industry. So nurses are really even more valued in their skills and their knowledge to support, this shortage of particularly vets that's happening. And then in terms of holistic, well, I say work out what you want to do, because there's lots of modalities, right? So two main ones to consider obviously is your herbal medicine and homeopathy, and then there's lots of different rehab type modalities like massage, kinesiology, taping, hydrotherapy. So if there's a particular one that interests a nurse, go down that path and find an accredited course. So that's something you need to really keep your eye out for, because you need to then be able to get insurance to allow you to use it in your practice, whether it's with your clinic or if you're going out on your own. So making sure that you don't just find a course that looks interesting, make sure it's accredited so you can go and get that insurance to practice in it and make your money back.
Yes. Yeah. Good tips. So then what has been the most rewarding thing out of if you can just sum up your career, what to you has been the best thing?
I think for me is when I get a case that has kind of been just like disregarded, that they've run out of traditional, options, and I get the referral kind of, I guess, in a joking way, but as a means for the owner to explore like last ditch efforts. And then that pet makes a full recovery using holistic treatments, whether it be rehab modalities or herbal medicine. That's always really rewarding. But it also is a way that we plant seeds, right? When things change and an outcome changes that wasn't expected for someone, they then will refer again. So we sometimes get, really staunch traditional practitioners starting to see, maybe there are some things we can explore differently, which I love, right? Because it happens, just by nature that they might, be led down a different path. So they're always like the highlights for me.
Yeah. And then what is your number one tip for those that may be considering a career change or taking up vet nursing? What would you say to them?
I would say find a mentor, find someone that you can bounce your ideas off. I think the biggest detractor from the industry is the remuneration. So, maybe start and just start it as the side, and then you can transition into it as a profession if you're really passionate about it. But to start somewhere. I get lots of nurses all the time message me, and it's purely because they're looking for a mentor. It can be an industry that sometimes is, not so collegial in that sense. So, find someone that's willing to chat about courses they can do or ways you can upskill, or just, go and do a day in a clinic or go and do a day with a mobile vet nurse. See if you like it before you rush in. I guarantee you'll like it. But, there's always ways you can sort of try before you buy.
Yeah. Oh, thank you so much, Dr. Roz. That's been so insightful into vet nursing and how people can take up the career. Where can our audience find you?
So you can find me on Facebook and Instagram at The Natural Vet Nurse, and also Australian Pet Nutrition. So you can see, I flit across both channels, so you can join us on both.
Awesome. And then if our listeners are in Darwin, are you taking on any new clients?
Yes, and you can come and visit our clinic and see our awesome clinic. Or, if you want to brave the heat or the rain this time of year, reach out. We'd love to see you.
Beautiful. I want to come and work with you. Thank you so much. We'll put some links in the show notes for our listeners that want to find you. And thanks so much for joining us on another episode. I'd love if you'd follow or subscribe and leave a review. That would be great. This helps us reach more pet owners who might also find our podcast beneficial. And that's it. We'll see you next time.